All right. Well, we don't want to keep everyone waiting, so we'll go ahead and jump right on in. Good morning, everyone. So happy that you can join us on this Friday, March 24th, for our Institute addressing career counseling and employment needs, prioritizing the physical, mental, and economic health and well being of people living with HIV, Part 3. So, this has been an ongoing partnership between the North Carolina Central University Counselor Education Program and the National Working Positive Coalition, which we'll talk a little bit more about. But we're so excited to offer Part 3. Parts 1 and 2 over the last couple of years have been dynamic. So we're excited to come back to learn more and to train together. We have people joining us from all over. If I could just, I wish I could count all the states that people are coming from, but we're all over to come together to learn more about this very important topic. So thank you for taking the time to be here. My name is Dr. Regina Gavin Williams, and I have the privilege of co-sponsoring and co-hosting this program with the National Working Positive Coalition. I am an assistant professor in the counselor education program at NCCU, and I also serve as the director of the career counseling program. So very excited to partner with Mark for this training institute. And then we'll move to the next slide. So just some housekeeping things. We want you to make sure to enter your first and last name as your Zoom when entering the meeting. And the reason why we do this is because we want to make sure to give everyone appropriate credit if you're here for any kind of CEU certificate, whether that's through NBCC, whether that's a CRC. We want to make sure that you get your credit. So if you don't mind changing your name to your first and last name, that's going to help us readily identify one who's in the room, but also to connect your time here with us for those CEUs. So thank you for your attention to that. We are training this, we are recording this training event. So just know that we're going to video and audio record. So we ask that you please mute yourself when you're not speaking. But we also want you to use the chat feature to ask any questions or make comments and share information, as well as we would like for you to use the raise hand function or any reactions to come off of mute. So if you do want to raise your hand, if you do want to speak and unmute your mic, just use that raise hand or the reactions to come off. During that time. That's specifically going to be important during the Q&A and also the discussion as well. And we do have closed captioning available for those who will need that. And also, we're going to ask you at the very end to just please take a moment after this webinar to fill out our evaluation. We want to know how you received all of the information during our training time together. It's also going to help us, again, readily identify those folks who need CEU certificates. So you need to fill out the evaluation in order to get that. And then just overall, whether you need the certificate or not, we just value and greatly appreciate your feedback. So please do that. All right, next slide. All right, so a little bit more about our continuing education units very quickly. For those who are in need, we have up to 4 hours or credits that are going to be provided for those who pre-registered. And those are in the areas of the National Board for Certified Counselors for NBCC, and also those for the Commission on Rehabilitation Counselor Certification, or CRC. So depending on how you registered is how you're going to be able to get which particular certificate. Again, up to 4, and we will need for you to complete the post-training evaluation survey with your name and your email address on that particular evaluation in order to get those credits. Next slide. And here's our agenda for today. So we have a action packed agenda. It's going to be so great. So we hope that you can stick with us throughout the duration if your time permits. Um, Starting out with the opening and welcome, I do want to share a little bit about the keynote speaker. Our keynote speaker, Benita Ray, unfortunately, is sick and won't be able to join us today. So we do wish her a very speedy recovery for this time. And so unfortunately, she will not be able to join us. However, we do have another dynamic person, Martha Cameron, who has graciously agreed to give us some opening remarks. So we'll be hearing from her very shortly. We'll have a panel following that, panel one on employment related needs and strategies unique to lifetime HIV survivors or people who acquired HIV at very young ages. Following that, for panel two, will be the role of employment and employment services in the journey of Black people living with HIV. And then panel three will be highlights from a 2025 research literature review project, studies related to HIV and employment. So we will be doing those in succession of each other. I do ask that if you need to take any breaks at any point, we won't have any scheduled breaks. So just whenever you need to, feel free to excuse yourself and take that break and come right on back because we'll be rolling through the duration of the afternoon until up to 1 o'clock. So please take care of yourselves as needed. Next slide. I just want to give a very special thank you to my program, the NCCU Counselor Education Program, for all of their leadership and support and always allowing us to just go with topics that are near and dear to our hearts to better train our students as future counselors, this being one of them in the third year. So just a special thank you to the NCCU Counselor Education Program, as well as the NCCU School of Education. Most notably, our leadership, Dean Audrey Beard, our Associate Dean, Dr. Jeffrey Warren, our Department Chair of Counseling and Higher Education, Dr. Chad Royal, and our co-program coordinators, Dr. Peggy Whiting and Dr. Helen Lupton-Smith. Thank you all so much. For those who are unfamiliar with our program, we do train students in 3 different tracks: clinical mental health counseling, school counseling, and career counseling. And so our students are going out to be change makers with a very social justice oriented lens. So having institutes like this help them in their training and working with people in the field in our communities. So thank you again. All right. So it looks like the chat is already bumping, popping. I love it. I love it. I love it. Well, let's learn a little bit more about you. Just tell us now if you can enter your current location. Where are you coming from? Your town, city, state? Enter it into the Zoom chat box. We just want to see where everyone's coming from and for you all to see with one another as well. So you could just take a moment to do that. Where are you located? Let's see here. We got Denton, Texas, Cook County, Springfield, Illinois. Yes, University of Chapel Hill right down the street. All right. Center for AIDS Research, New Orleans. Okay. Wayne, Indiana, Chicago, Elizabeth City State, one of our other neighboring institutions close in our state, Connecticut. Columbia, South Carolina. All right. All right. We see Puerto Rico. Okay. Yes. Decatur, Georgia. I'm from Georgia, from Jonesboro. Love it. Thank you all. Let's see. Iowa, North Dakota. Wow. New Mexico. This is really great, everyone. Awesome. Okay. So while you're putting that in, the other thing we would love to know, if we can click to the next slide, is I'm going to launch a quick Zoom poll. If everyone's familiar with that, it's going to pop up on your screen in just a moment. And I want you to please choose one or more of the below to identify your current role and or work, because we want to see who's coming from our audience. I'm going to launch that. You should see it up on your screen now. And click one or more. We want to see where our our audience is coming from today. While you're doing that, I see Atlanta, Georgia. All right, student from MedBen currently in Atlanta. Awesome. Good morning. New York, New York, Charlotte, Brooklyn, Illinois. Okay. Murfreesboro, Illinois, LA, California. Nice. All right. Do we have any more people who want to participate in our Zoom poll? We'll give it about 30 more seconds. Okay. It ended. All right. So, looks like we have, everybody see our results here? 58%, we have a lot of vocational rehabilitation counselor administrators here. Okay, we have college students. I know that not everyone got a chance to participate in the poll. That went really fast. So we only got about 53%. But we do have people represented from college students, college university professors, counseling service provider administrators, HIV service provider administrator, HIV advocates, vocational rehabilitation counselor administrator, and other. All right, thank you for participating in that. All right, next slide. All right, now I'm going to pass it over to Mark to introduce the National Working Positive Coalition.
Thanks so much, Dr. Gavin Williams. I am so deeply appreciative of this incredible opportunity that we have had to partner with NCCU. And I just want to say, if anyone ever comes across the potential opportunity to collaborate with Dr. Regina Gavin Williams, do not let that opportunity pass you by. It has been just a tremendous privilege, and I'm so grateful. I want to welcome everybody and thank you all for joining us here this morning. I see an extraordinary range of expertise represented in our group of attendees in this Training Institute today, and I am humbled and deeply appreciative. I'm super excited that all of you have joined us today with this incredible group of experts and leaders from across the country that have joined us today to share some of their own observations, their insights, their experience, share some of their own stories. There's a remarkable opportunity today that I am deeply appreciative of. I want to just say a couple of words about the National Working Positive Coalition. I serve as the executive director of the NWPC and do so with the privilege of working alongside Sylvester Askins Jr. as our training director, Heather O'Connor as our communication specialist, and alongside Vanessa Johnson, who serves as our board president. The NWPC works to strengthen responses to the employment needs of people living with or at greater vulnerability to HIV. And we have been around for a little over 20 years. We were founded in 2003. I am in this moment, which is so fraught and challenging for so many of us, deeply appreciative of the opportunity for this work to help strengthen the responses to needs that have historically, quite honestly, throughout the course of the HIV epidemic, been marginalized. The work that we do includes serving as a central resource at the national level for HIV and employment information, research, capacity building, and technical assistance. And I very much welcome any and all of you to connect with us. Let us know how we may help support and encourage the work happening in your communities, and help in support of any opportunity to assist people living with or at greater vulnerability in connecting with the services, the information, and the resources they need to pursue employment. Next slide, please. I want to really take a moment to express our deep appreciation to Vive Healthcare and their Positive Action Community Grant, which has helped make our work on this virtual training institute possible. And with that, I will just say I'm so deeply grateful that today we will have a chance to hear some of the stories and some of the insights that have too rarely been spotlighted across the history of the HIV epidemic. And I'm deeply thankful to NCCU for making this possible. And I am truly awestruck to see that we now have 100 people that have come together today to try to make positive change happen collectively. And please keep me posted how I and the National Working Positive Coalition can support that effort. And as I turn it back over to Dr. Gavin Williams, I'll put my contact information in chat and welcome folks to let us know how we may help support your efforts. Thanks so much.
Thank you so much, Mark.
Next slide, please.
Oh, if we can go, there we go. All right. So I talked about this just a little bit earlier, but we asked that you complete the evaluation survey at the very end of our time together. There is a QR code to scan. I'm also just going to drop the link in the chat so you have it there and just keep that handy. Let's see, I don't know if I can pin it or not, but that is the link to the survey. So I'll just give you a moment, and this will come back up at the very end, but I'll give you a moment to scan that or keep the form handy so that as you go through our time together, you'll be able to fill out an evaluation for that. All right. Okay, so hopefully everyone has that. We'll give you just a couple more seconds to get that. All right, thank you. We can move to the next slide. Okay, so today with us, we have Martha Cameron, who's going to give us some opening key remarks. Thank you so much, Martha, for being with us. Martha is a research specialist for Georgetown University. She's also the director of the International Community of Women Living with HIV North America and the commissioner for Washington, D.C. for the Regional Planning Commission on Health and HIV. And I was told that this is just a snapshot of all the things that Martha Cameron does. So thank you, Martha, for being with us, and we'll turn it over to you.
Thank you so, so much for having me this morning. And I think Mark has already said that I am stepping in or filling in for really, really big shoes. Vanita Ray is an amazing HIV advocate who is currently the chair of the People Living with HIV Caucus, of which my organization and NWPC and many other networks are a part of. And also works in the South, where we know that HIV has deeply impacted folks. And so just a big shout out to her. And I want people to acknowledge I am feeling very big shoes. So really excited to be here. I have been, I think, to every one of these sessions as a panelist, as a staff of NWPC, where I served for a year, as Mark's deputy before I had to go back to school and work in research at Georgetown University. Um, I have also been an executive of the International Community of People Living with HIV, which serves women living with HIV here, and we have 10 regions around the world. But I think what hasn't been said here is that I am also a person living with HIV. I was diagnosed in 2003, and I was diagnosed in Africa, a country called Zambia. Sometimes I find people know where it is, and sometimes people don't. But it's located in sub-Saharan Africa, which was heavily impacted by the HIV and still is impacted by the HIV epidemic. So when you see me here today, I can wear multiple hats. I am a Black woman living with HIV. I am an immigrant living with HIV. And I can go on and on about those intersecting sort of personalities that really, really lent to this idea of being a woman or being a person living with HIV here in the US. I don't represent everybody. We have so many different populations that are impacted by this epidemic, LGBTQ brothers and sisters that were initially heavily impacted by this. The Black community at large is heavily impacted. And then we know that a lot of us living with HIV live under a federal poverty line. It is true that all the health disparities that probably predisposed us to HIV in the first place really, really continue to make us vulnerable. But I wanted to spend a little bit of time, and I'm using every opportunity I get to talk about the unprecedented times that we find ourselves in. And I take this opportunity because, as Dr. Regina said earlier, we have an amazing group of people participating. We have the vocational and rehabilitation counselors. We have counseling students, all of which may be a touch point of people living with HIV either now or in the future. And the things that are going on now in our world deeply, deeply impact people living with HIV. But I think the other part of this is that what is going on now is indiscriminately impacting everybody. Everybody. The world changed in January. And there's so many things that have been happening day to day. But most recently, something that we have to be really aware of that we as a community are fighting right now are these amazing, amazing attacks on our community. And they are coming in many different forms, right? We have heard about the executive orders that impact even very specific communities in a way that demonstrates, for lack of a better term, hate. We have all these Dodge firings. We have a reconciliation process and appropriations process in the federal government that is absolutely about to disseminate healthcare as we know. It is important that as we are thinking about people living with HIV, and I know this is especially associated with employment, that many of us who live with HIV face different disparities. And so I speak especially to those people that may not already be working in HIV about how important it is for you at this moment in time to stand alongside people living with HIV, the LGBT community, and Black folks at large, right? Excuse me. So I just want to zoom in. Oh, excuse me. Sorry about that. So our federal government is looking to cut about $800 billion. And the only way they can do that is by disseminating Medicaid, which is the largest public health service that especially serves people living with HIV, right? This means that there'll be a restriction in eligibility, services, and benefits. Our healthcare systems will be overburdened. And this is simply because even though this money is being slashed at a federal level, it is sent to our states, and the states end up really having to bear, and they can't be able to really match what has been given them to the states. We're looking at racial, gender, and even reproductive health injustice. We're looking at structural violence that is happening against the LGBTQ community. And we're looking at hospital closures, especially in rural areas where some of us might find ourselves in. And most certainly, we might be looking at a loss of coverage for people living with HIV in our communities. This has already happened globally. Like I said, I'm wearing a global hat. So you've heard about how USAID and PEPFAR have been shut down. And these two programs have served people living with HIV globally for over 30 years. And in some, especially poor countries, this can be a very huge impact. And let's not be sort of misinformed. They try to show as if the money that goes to some of these African countries is a huge amount. It is less than 1%. It's about 0.7% of the entire budget that goes. So it's not a lot. We know that Medicaid covers 1 in 5 people everywhere. And in some places, it's more than others, especially for those of us that may be located in the South. It covers our prescription drugs, inpatient and outpatient care, and essentially, it really improves health outcomes and protects people from medical debt. So what is really, really going on? What we're seeing, we haven't seen, a lot of people are even referring back to the when this administration was there a few years ago, but we can go all the way back to the first and early days of HIV in the Reagan administration when they wouldn't even say HIV. Nobody would say HIV. This is a huge attack. And we would go back to the days when we saw people die, when especially there was a lot of discrimination for the gay community, but this has expanded, of course, to the larger LGBTQ community, and we cannot stand by and watch. For all of you as counselors, vocational rehabilitation, I know you end up working in different places, in different hospital healthcare settings, but I really do want you to know that this is going to impact all of us, and we are trying to rally an army to protect Medicaid, not just for people living with HIV, but to every person that deserves healthcare here and globally. I know I spent a lot of time on that, but right now we are in a crisis as the people living with HIV community. And we need to rally support from every corner. This is not just about our community. We need every community. Medicaid serves those who are disabled. Medicaid, in places where it expanded, has allowed younger folks to stay with their parents on insurance. It has really helped people to have access to healthcare. And like those early days when you would literally have to be on your deathbed in order to get onto Medicaid. And what we might see happen as well, and this is something we're fighting against, is that folks who are already impacted in many different ways as we age with HIV, with comorbidities and other disabilities, is that they might enforce work requirements, for example, on people living with HIV. And for you guys as vocational rehabilitation counselors, this would be really key. We have wanted and support people going back to work for those that are able. Later on, you're going to hear about models that have, set up a framework in which people can go back to work as they are able. But on the flip side of that, we want to make sure that this does not disqualify them for their eligibility to get health care. And so, if you go away with anything from these few remarks of mine is to really understand that our community is in crisis right now, and we are rallying the troops. We are forming coalitions with people that are not just of the people living with HIV community. We're forming coalitions with anybody and everybody. Knock on your neighbor's door, knock on anybody's door, and have them understand that Medicaid will impact everybody, but especially those folks living with HIV. Let me kind of finish on a happier note. When I first came to this country, and wasn't necessarily eligible for insurance, I accessed the Ryan White services. The Ryan White services are provided by the federal government as well as a payer of last resort for people that are unable to get any kind of insurance. So for the first few years of me being in this country, I was able to get Ryan White services. And not only was I able to do that, I was also privileged to work with an organization called the Women's Collective in DC that served women living with HIV, and especially Black folks living with HIV. And I was struggling then. I was, wondering, how am I going to make it in these, American, how am I going to make it in this American country? How am I going to pursue this American dream with all these hats that I wear, a dream that is, looking very far off. But when I was at the Women's Collective, I wondered, would I be able to go back to school? Will I be able to get a decent job? And it was then that I actually ran into Mark at a conference, and he was talking about all these amazing possibilities for people who have been living with HIV, may have been sick at some point, but could take certain steps to come out of whatever status that they were in, to be able to seek employment and to be able to even go back to school, that there were resources available for people living with HIV that I had no idea that were available. And I felt really, really inspired by all of this. Not only was I able to go back to school, which I never ever thought I would, but I was also able to get some really amazing different kinds of employment. I was able to come out of the paying rent, and I was able to purchase a house with my family. I was able to do things that I never ever thought I would do, knowing that there is actually a process that is guided by counseling. Although in that time, I really relied on every little word that came out of Mark's, workshops and teachings and so on. And I find myself here. And I was really privileged to then later work for, National Working Positive Coalition. And I will forever be an advocate of trying to empower people living with HIV to understand that they can do it if they're able to go back to school, to get better jobs, to ease out of unemployment and disability and make their lives better. And especially in this environment that we find ourselves in, I think this is going to become so critical. And therefore, your jobs, especially as counselors, are going to become so critical to encourage us, to motivate us, to help direct us back into a place where we can ease out of some of the situations that we're in, have an income, and be able to support ourselves and our families. And so I'll always be an advocate for the National Working Coalition. And I trust that you're going to learn a lot today from some of the amazing panels that I've seen here, that will help you in your counseling and vocational rehabilitation journeys. Thank you so much for having me. And I look forward to hearing what else we have today.
If we could just give a virtual round of applause to Martha Cameron for gracing us with this information this morning in these opening remarks. We greatly appreciate you for not only being open to sharing your own lived experiences, but also just allowing counselors and future counselors on this call to really recognize and understand the importance of their work in supporting people who are living with HIV as it relates to counseling and career services and employment, and similar ways that you were able to gain and be successful in where you are and where you're situated today. So we're happy to see that, and also to just share some insight as to what we're facing with the current administration as it relates to services and support for people living with HIV. I think it's important for us to be aware of that. And so I'm looking forward to more insight from the panels as well. But thank you so much for your words this morning. Awesome.